Crucial warning. 10 signs of low blood oxygen levels revealed. Welcome to our video discussing the 10 indicators of insufficient oxygen levels in the bloodstream. Have you ever experienced shortness of breath or persistent fatigue, even after a restful night's sleep? It might be an indication that your body's tissues are not receiving an adequate supply of oxygen through your blood. This video will explore 10 common symptoms that may suggest low blood oxygen levels. A friendly reminder: this video is for educational purposes only, so consult your doctor if you have any medical concerns. But before we continue, don't forget to subscribe to our channel for more daily tips like this, and turn on notifications so you never miss our new videos. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by licensed healthcare specialists before we proceed. So, let's delve into the vital role of oxygen in our bodies. 1. Shortness of breath. Have you ever experienced a feeling of breathlessness, even when you're at rest and not exerting yourself? It might make you feel as if you just completed a marathon, even though you're sitting down and relaxing. This unsettling sensation, known as dyspnea, is relatively common and can occur for various reasons. One of the most frequent causes is a decrease in oxygen levels in the bloodstream. Before we explore why low oxygen levels lead to shortness of breath, let's first understand how the body regulates oxygen levels. The lungs, the primary respiratory organs, take in oxygen and release carbon dioxide as a waste product of metabolism. Oxygen enters the lungs, diffuses into the bloodstream, and binds to hemoglobin, a protein found in red blood cells. Hemoglobin then carries oxygen to the body's tissues and organs, where it is used for energy production. When blood oxygen levels drop, the body compensates by increasing both the rate and depth of breathing. Specialized cells in the arteries detect low oxygen levels and send signals to the brain, which, in turn, prompts the respiratory muscles to intensify breathing. This response aims to bring more oxygen into the lungs, increasing the amount of oxygen that can bind to hemoglobin and be transported to the tissues. However, if oxygen levels continue to decrease, the body's compensatory mechanisms may not be enough to maintain adequate oxygenation. This is when the feeling of breathlessness can set in. The body interprets the low oxygen levels as a suffocating sensation, leading to a sense of breathlessness. It's as if your body is signaling you to breathe more deeply and frequently in an attempt to increase oxygen intake. Furthermore, when oxygen levels are low, the body may produce more carbon dioxide than it can eliminate. This buildup of carbon dioxide can also contribute to the feeling of breathlessness. The brain contains specialized receptors that detect changes in carbon dioxide levels. When carbon dioxide levels rise, these receptors signal the respiratory muscles to increase breathing rate and depth to eliminate the excess carbon dioxide. 2. Rapid breathing. When oxygen levels in the blood decrease, the body's natural response is to increase the rate and depth of breathing to intake more oxygen. This intensified breathing, known as hyperventilation, often manifests as a common symptom of low oxygen levels in the bloodstream. While hyperventilation can be beneficial in certain situations, such as during exercise when the body requires more oxygen for physical activity, it can have adverse effects when it occurs in response to low oxygen levels. Hyperventilation can lead to the excessive loss of carbon dioxide, which, in turn, can further reduce oxygen delivery to the body's tissues. The occurrence of hyperventilation in response to low oxygen levels can be attributed to the body's respiratory control system, located in the brainstem. This system regulates breathing rate and depth based on inputs from various sensors in the body, including those that detect oxygen and carbon dioxide levels. When the sensors detecting oxygen levels sense a drop in blood oxygen, they send signals to the respiratory control system, signaling the need for more oxygen. As a result, the respiratory control system increases the rate and depth of breathing to enhance oxygen intake. However, if the oxygen levels continue to decline, the respiratory control system may become overly active, leading to hyperventilation. Hyperventilation can give rise to a range of symptoms, such as dizziness, lightheadedness, tingling in the fingers and around the mouth, and even fainting in severe cases. If you experience these symptoms, seeking medical attention is important, as they could indicate an underlying and potentially serious medical condition. 3. Wheezing. Wheezing is a prevalent symptom that may occur when blood oxygen levels are low. It manifests as a high-pitched whistling sound when air passes through narrowed airways. While commonly associated with respiratory conditions like asthma and chronic obstructive pulmonary disease (COPD), wheezing can also be a response to low oxygen levels. As mentioned earlier, when blood oxygen levels decrease, the body's respiratory system attempts to compensate by increasing the rate and depth of breathing. However, in some instances, the body may respond to low oxygen levels by narrowing the airways. This can happen due to various reasons. One possible reason is the production of substances by the body that cause airway constriction. For instance, histamine, a chemical involved in the immune response, can lead to airway narrowing. Individuals with asthma or allergies might experience wheezing in response to exposure to allergens or other triggers, which induces this response. Another factor contributing to wheezing in response to low oxygen levels is the inflammation or narrowing of the airways themselves. This may be more prevalent in people with lung diseases like COPD, where the airways are already inflamed and become more susceptible to narrowing when oxygen levels drop. 4. Confusion. Confusion is another symptom that can manifest when the body experiences low oxygen levels in the bloodstream. When the brain doesn't receive an adequate oxygen supply, its proper functioning is compromised, leading to cognitive issues, including confusion. The brain heavily relies on oxygen and requires a continuous and sufficient oxygen supply to maintain its functions effectively. However, when blood oxygen levels decrease, the brain may not receive enough oxygen to meet its demands, resulting in cognitive problems, such as confusion. Various factors can contribute to low oxygen levels in the blood, including respiratory conditions like pneumonia or acute respiratory distress syndrome, ARDS, which impede proper oxygen uptake in the lungs. Additionally, heart-related or circulatory issues like heart failure or shock can also lead to diminished oxygen levels in the bloodstream. In some instances, confusion may present itself as the initial symptom of low oxygen levels, particularly among elderly patients or those with pre-existing cognitive impairment. Alongside confusion, other symptoms may accompany the condition, such as shortness of breath, rapid breathing, and an accelerated heart rate. 5. Headache. When our bodies experience insufficient levels of oxygen, it can lead to a commonly experienced symptom known as a headache. Headaches can occur for various reasons, including changes in blood flow and inflammation. However, one of the primary culprits behind headaches is the lack of oxygen supply to the brain. When the blood lacks sufficient oxygen, the brain's proper functioning is compromised, leading to the sensation of a headache. The reduced oxygen levels can leave the brain unable to meet its oxygen needs, resulting in discomfort and pain in the form of a headache. Interestingly, headaches can also manifest as a symptom of high-altitude sickness. This condition occurs when individuals ascend to high altitudes where the air is thinner and contains lower levels of oxygen. In such cases, insufficient oxygen at high altitudes can trigger headaches, along with other symptoms like fatigue, dizziness, and shortness of breath. 6. Blue-tinted skin or lips. Blue-tinted skin or lips is a medical condition referred to as cyanosis. This condition occurs due to inadequate oxygen in the blood, causing the skin and lips to take on a bluish or purplish hue. When the body's tissues don't receive sufficient oxygen, it compensates by redirecting oxygen-rich blood to vital organs like the brain and heart, prioritizing them over non-vital organs, including the skin. As a result of this redirection of blood, the skin and lips may appear blue, signaling insufficient oxygen reaching these areas. Cyanosis can arise from various conditions, including respiratory and circulatory problems. Additionally, exposure to cold temperatures or high altitudes, where oxygen availability in the air is reduced, can also cause cyanosis. In such situations, the body may struggle to take in enough oxygen to meet its needs, leading to a lack of oxygen in the blood and subsequent cyanosis. 7. Chest pain. Chest pain is a prevalent symptom that can arise from various conditions, including heart issues, respiratory problems, and gastrointestinal disorders. However, one of the primary causes of chest pain is angina, a condition resulting from a lack of oxygen supply to the heart muscle. Angina occurs when the coronary arteries, responsible for providing blood to the heart muscle, become narrowed or blocked, leading to reduced blood flow to the heart. This diminished blood flow can trigger chest pain or discomfort, often described as a sensation of tightness, pressure, or squeezing in the chest. Angina is typically induced by physical activity or emotional stress, which increases the heart's oxygen demand. When the available oxygen is insufficient, the heart muscle may not function properly, resulting in chest pain. It is essential to recognize that angina can be a warning sign of underlying heart disease, such as coronary artery disease, which occurs due to plaque buildup in the arteries supplying blood to the heart. Risk factors for heart disease include high blood pressure, high cholesterol, smoking, and diabetes. 8. Fatigue. Fatigue refers to a sense of weariness, weakness, or depletion that can stem from various factors, including physical, psychological, and lifestyle-related elements. One of the main contributors to fatigue is insufficient oxygen reaching the body's tissues. When the blood lacks adequate oxygen, the body's usual functions may be hindered, leading to feelings of tiredness and weakness. Other factors that can add to fatigue include poor sleep, stress, depression, and anxiety. These psychological aspects can disrupt the body's hormonal balance, resulting in sensations of tiredness and weakness. Additionally, lifestyle factors like improper nutrition, lack of exercise, and dehydration can also contribute to fatigue. When the body is not properly nourished and hydrated, it may lack the energy necessary to carry out its regular functions, leading to feelings of tiredness and exhaustion. Furthermore, fatigue can be a side effect of certain medications, such as antidepressants, antihistamines, and sedatives. These medications can have an impact on the body's energy levels, contributing to the overall sense of fatigue. 9. Dizziness. Dizziness is characterized by a sensation of lightheadedness, unsteadiness, or a spinning feeling, and it can result from various factors, including decreased oxygen levels in the blood. When there's insufficient oxygen in the bloodstream, the brain may not receive the necessary amount of oxygen for proper functioning, leading to feelings of dizziness or lightheadedness. Multiple other factors can also contribute to dizziness, such as low blood pressure, dehydration, anemia, and certain medications like blood pressure medications or sedatives. Identifying the root cause of dizziness is crucial to determine the appropriate treatment. Addressing the underlying cause may involve lifestyle adjustments, such as staying hydrated and getting adequate rest. Alternatively, medical treatment may be necessary for underlying conditions, such as respiratory or heart problems, which could be contributing to dizziness. 10. Sweating. Sweating is a prevalent symptom that may arise when there is a low level of oxygen in the blood. This is because the body's natural response to low oxygen levels involves increasing blood flow and oxygen delivery to the tissues, which can lead to sweating. Additionally, hyperventilation, which is an attempt to increase oxygen intake, can also cause sweating as the body works to cool itself down. Various other factors can contribute to sweating, including anxiety, stress, and certain medications like blood pressure medications or antidepressants. Remember that if you experience any of the 10 signs we discussed today, it's essential to seek immediate medical attention. Low levels of oxygen in the blood can have serious consequences, but with prompt treatment, you can get back to feeling your best. As always, it's always vital to care about your health. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Engaging in the act of subscribing to and sharing our posts is a commendable deed, as you never know when this valuable and transformative information might be of great significance to someone in need. Thanks for watching.